Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is August 31st, 2025. This video is on a Lancet article published online first on August 30th, 2025, titled Beta Blockers After Myocardial Infarction with Mildly Reduced Ejection Fraction, and individual patient data meta-analysis of randomized controlled trials. Beta blockers reduce mortality post-MI, especially in patients with left ventricular ejection fraction equal to or less than 40%. Unclear benefit in those with mildly reduced left ventricular ejection fraction, 40 to 49% without heart failure. The ACCHA guidelines is a class 1 recommendation, and in the ESC it's a class 2A for patients with left ventricular ejection fraction greater than 40%. Methods: the study investigators used individual patient data and did a meta-analysis from 4 randomized controlled trials: the REBOOT, the BETAMI, the DANBLOCK, and the CAPITAL-RCT. The study cohort comprised of 1,885 individuals. 991 were on beta blockers, 894 were controls. The follow-up period was a median of 3.5 years. The primary outcome was a composite of all-cause death, new myocardial infarction, or heart failure. They used a one-stage Cox regression model, no trial heterogeneity, p-value 0.95. What did they find? The primary endpoint, 11% in the beta blocker group versus 14%. Hazard ratio 0.75, p-value 0.031. No significant differences in individual outcomes, but all trended favorably. Consistent benefit in age less than 75 years. P-value for the interaction 0.035. Limitations: this is an open label trials. There was crossover, limited power for secondary outcomes, no long-term left ventricular ejection fraction reassessment or hemodynamic monitoring. The key takeaway: beta blockers offer a 25% risk reduction in patients with myocardial infarction and left ventricular ejection fraction 40 to 49%. The benefit is consistent across trial and geographies. Supports beta blocker use in post-MI patients with mildly reduced left ventricular ejection fraction. Clinical pearls: patients with left ventricular ejection fraction 40 to 49% behave more like HFrEF than HFpEF in outcomes and response to beta blockers. Benefits seen despite absence of heart failure symptoms during index myocardial infarction hospitalization. Survival benefit emerges after 3 months and continues long term, suggesting the importance of sustained therapy. Current guideline ambiguity, ACCHA class 1 and versus ESC class 2A, may be clarified by this analysis. Subgroup ages below 75 benefits the most. Elderly patients may require more individualized approach. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by Master MedFacts at mastermedfacts.com.